Welcome everybody, thanks for coming on the Zoom. This is a lunch and learn presented by Jackie Green at Cancer Services of Western New York. Jackie has recently transitioned to the role of outreach coordinator for the Center Services program of Steuben, Allegheny, Cattaraugus, and Chautauqua counties, a program funded by the state of New York and administered by St. James Hospital in Hornell, New York. In her role, she is responsible to educate our communities about the importance of cancer screenings and assist the uninsured populations of Steuben, Allegheny, Cattaraugus, and Chautauqua counties to get free cancer screenings. She's an experienced outreach coordinator with a demonstrated history of working in the medical industry with organizations such as Connect Life and Mercy Flight of Western New York. While she enjoys the personal one-on-one interaction that she is able to get in her daily work, the real reward comes from the knowledge that lives can be saved and the quality of lives can be improved. Jackie splits her time between homes in Angelica and Lakewood with her fiance, where she is a mom to 2 daughters and a feisty Shorkie named Kingston. So Jackie, it's all yours.
Okay, and hopefully we won't be hearing from that feisty Shorkie today, so tucked away. Who needs ABT when you've got a little dog?
Exactly. Exactly.
Okay, well, thank you for the introduction, Heather. My name is Jackie Green, and I am an outreach coordinator for the Cancer Services program of Steuben, Allegheny, Cattaraugus, and Chautauqua counties. And as Heather mentioned, we provide free breast, cervical, and colorectal cancer screenings to uninsured individuals in our serviced area. And joining us on the call today is our program manager, Camille. Mikhail. You want to say hi, Mary?
Hi, everyone. I'm so glad that you're allowing us to present again. I know we did it for cervical and colorectal, and we certainly appreciate the opportunity to do that. And
we love having you.
Yeah, I'm very lucky to have Jackie and Kim on our team here at Cancer Services. If there's ever any other education sessions you need done, just please give us a call.
Absolutely, thank you.
And also on the call is Kim Mcintosh, and she is the outreach coordinator who handles mostly Steuben and Allegheny County. You want to say hi, Kim? Or not? She's a little shy.
Hello. Yeah, as Jackie said, I do tend to cover more of Steuben and Allegheny County just because of our geographic locations, but we certainly both do our best to cover all 4 counties.
Okay, thanks, Kim. Well, as some of you may be aware, October is Breast Cancer Awareness Month. So today I want to talk to you a little bit about breast cancer and the importance of cancer screenings. Now, as a disclaimer, I am not a trained medical professional, but I do hope that the information that I'm going to provide you with today will give you the knowledge and motivation to get yourself screened and encourage others to do so. We're going to start sharing the presentation here. And I am going to go ahead and just shut off my camera so you can see all the good stuff that I have to present. So I'm sure everyone here has or knows someone who has been affected by breast cancer. Now, according to the CDC, approximately 14,000 women in New York State are newly diagnosed with breast cancer each year, and almost 2,500 will die from this disease annually. What you may not know is that in many cases, regular screenings can detect breast cancer early, making treatment easier and more effective. So did you know that breast cancer is the most common type of cancer in women? That breast cancer is the second leading cause of cancer death in women after lung cancer? That Black women are more likely to die from breast cancer than white women? And that a mammogram is the best way to find breast cancer early. So what causes cancer? Well, cancer is a condition where abnormal cells grow out of control. These abnormal cells form masses known as tumors. So a common question people have is, what causes cancer? There are many types of cancers with many possible causes, and multiple things can affect a person's chance of getting cancer. While doctors don't fully understand the causes, there are some things that we know that can increase the chance of cancer happening, and they are known as risk factors. So some of the risk factors that can affect a person's chances of getting cancer include their age, their race, and their family history. And family history refers to a close relative. Having a risk factor does not guarantee a person will be diagnosed with cancer, and not having risk factors does not mean you can't get cancer. So what is breast cancer? Simply stated, breast cancer is a cancer that starts in the cells of the breast. It can spread to other parts of the body. For breast cancer, increasing age is a risk factor. Most breast cancers are diagnosed in women age 50 and older. Women with a personal or family history are also more likely to develop breast cancer, giving them an increased risk. This is a view of the anatomy of the breast from two different angles. A woman's breast has three types of tissue. Fibrous tissue holds the breast tissue in place. Glandular tissue refers to the lobules or the glands in the breast that produce milk, and the ducts, which are the tubes that carry the milk to the nipples. And adipose or fatty tissue fills the space between the fibrous tissue, lobules, and ducts. It gives the breast their size and shape. And as a woman ages, more fatty tissue forms in the breast. You may also heard of the term dense breasts. Breast density reflects the amount of fibrous and glandular tissue in a woman's breast compared to the amount of fatty tissue in the breast, as seen on a mammogram. Women with higher breast density have a higher risk of getting breast cancer, so it's important to maintain a schedule of regular breast screenings. So now let's talk about risk factors for breast cancer. Being a woman. All women can get breast cancer. Although the causes of breast cancer are still unknown, there are some factors that may increase a woman's chance of getting the disease. Men can get breast cancer, however, it is very rare. Getting older, most breast cancer is diagnosed in women age 50 or older. Having a previous breast cancer diagnosis or some non-cancerous breast diseases, and having a first-degree relative, meaning a mother, sister, father, or daughter, with breast cancer, especially if diagnosed at an early age. Now, family history does account for 5 to 10% of all breast cancers. And having gene mutations such as the BRCA1 or BRCA2 gene. Continuing on, never giving birth, never breastfeeding, or giving birth to a first child after the age of 30, and certain hormonal factors, such as having a menstrual period younger than the age of 12, starting menopause over the age of 55, and the long-term use of hormone replacement therapy. As we discussed before, women with dense breasts are at higher risk for breast cancer. Having exposure to high levels of ionizing radiation to the chest area early in life. And certain lifestyle factors. While some risk factors cannot be controlled, a healthy lifestyle can help to prevent cancer. So it's important to see your doctor for regular checkups, eat healthy foods, get regular exercise, maintain a healthy weight, and limit your alcohol intake. And as I say, it's easier to say that than to do that, I know. Continuing on with risk factors, all women can get breast cancer. A woman can have one or more risk factors and not get breast cancer. A woman can have no risk factors and still get breast cancer. This is why screening is important for all women, regardless of their risk factors. So these are only some of the symptoms of breast cancer. If a woman has these problems, she should talk with her healthcare provider. a lump in the breast or underarm, redness or flaky skin on the breast or nipple pain, nipple discharge not meaning breast milk, or a change in the shape meaning dimpling or swelling. Having these or other symptoms does not necessarily mean it's breast cancer, and some women with breast cancer do not have symptoms. Again, this is why regular screening is so important. All women age 50 and older should have regular breast cancer screening. Screening means checking for signs of cancer before there are any symptoms or problems. Common breast cancer screening tests include clinical breast exams and mammograms. A clinical breast exam is done with the healthcare provider using his or her hands to feel for lumps or other changes in the breast and underarm. Whether a woman has had a clinical breast exam or not, it's still important that she get a regular mammogram. Women are also encouraged to perform a monthly self-exam. While breast self-examination is not an evidence-based cancer screening test, it is good to know the normal look and feel of the breast in order to recognize changes and bring any concerns to the doctor. A mammogram is an x-ray of the breast, and it is the most effective way to find breast cancer early, years before it may be felt. During a mammogram, a technician will take 4 pictures of the breast. 2 will be taken from top to bottom, and 2 will be taken from side to side. This way, the doctor can get a look at all of the breast tissue. A mammogram may find a lump before it can be felt, or before any other symptoms like pain or swelling begin. The earlier a cancer is found, the better, as there may be more treatment options and the cancer may not have spread to other parts of the body. Also, keep in mind that an abnormal mammogram does not necessarily mean breast cancer. Most likely the doctor will ask for additional testing. So who should be screened for breast cancer? All women ages 50 to 74 years old should get a mammogram every 2 years. Some women younger than 50 should be screened for breast cancer. A woman who is younger than 50 should talk to her doctor about mammograms if she is 40 to 49 years old, has a family history of breast cancer, or has had any changes in her breast or nipples such as swelling, irritation of the skin, pain, discharge, or any of the other symptoms we talked about before. The best thing that a woman can do is talk with her doctor about when to begin screening and how often she should be screened. Although there is no known way to completely prevent breast cancer, there are ways to lower your risk. Drink less alcohol, get regular exercise, stay at a healthy weight, and breastfeed if you're able to. Exclusively breastfeeding the child during the first 6 months of life and continuing for 12 months or longer has been shown to reduce breast cancer risk. So the key takeaways for today are all women age 50 and older should get screened for breast cancer. Because women have different risks for breast cancer, all women should talk to their doctor about when to start screening and how often to be screened. Regular mammograms are the best way to find breast cancer early when it may be easier to treat. The Cancer Services Program offers free breast cancer screening for eligible uninsured New York State residents. If you or someone you know is uninsured or unable to afford cancer screenings due to high insurance deductibles, the Cancer Services Program may be able to help. In addition to free breast, cervical, and colorectal cancer screenings. We can also enroll uninsured individuals into the Medicaid cancer treatment program. This provides full Medicaid coverage throughout the duration of their cancer treatment. For more information about the services we offer, please contact us at 1-877-778-6857. And I wanted to thank you for your time and attention, and we are available for any questions that we may be able to answer at this time. Heather?
Why is the cutoff 74?
Mary, you just dealt with something similar. Can you answer this one? Oh, she's not on. Typically.
I'm
there you
here.
are. Okay, so the question was, why was the cutoff 74?
The answer is, I mean, generally at like, starting at age 65, most people get Medicare for our program. But 74, at that age, people, they just don't do that, for those women. They figure they've had their screenings for years, and if they're not gonna get it, they probably won't get it beyond that.
Okay.
Thanks, Mary.
I'm sorry, I couldn't start my video back up. I was trying to start video. There we go.
Technical difficulty. Does anybody else have any questions? I know we had someone, comment on our Facebook page about how they had a mammogram and they didn't see the lump, but then they had a sonogram and they saw the lump. And typically, the reason for that is they probably saw something on a mammogram and followed up with a sonogram. Because typically you don't start with a sonogram, you start with a mammogram. So that's another evidence of why mammograms are so effective, because if they see anything, any of those out there that have had a mammogram could probably agree with me, is if they see anything, they immediately send you on for further testing.
Yeah.
So just to make sure, yeah. Mm-hmm. And one of the things, I'm not sure if, we didn't touch on it today, but, and probably Mary has told you in the past, in addition to the breast cancer screening, which we talked about today, we also do the colorectal screenings, and distribute fit kits for uninsured folks. And those are the take-home fecal tests, like the Cologuard, similar to those, which is great.
Yeah, it's a little less invasive than, if you don't have any family history, a lot less invasive than going for your colonoscopy to start. And generally, we would only send those to people without any kind of family history of colon cancer.
Mm-hmm.
Does anybody have any other questions? Well, thank you, Jackie, Kim, and Mary Camille. Thank you so much for presenting today. I'll reach out here come March, because that's when colorectal and set up another lunch and learn. Lori, did you have a question?
No, I was just gonna say thank you for the presentation.
Oh, yes, thank you so much.
Thank you for having us.
We
Thank you.
appreciate
We
it.
appreciate the opportunity.
Thank you so
We
much.
appreciate the opportunity. Thank you, everybody.
Thank you.
Stay healthy.
Yes, you
Bye.
too. Bye-bye.
Thank you.
Bye.
Have a good day.